how do we give visibility to that? So I think what we're saying to Sheffield Children's Hospital is that they're following the RTT rules in their same sense that they should continue to do that, whilst we'll run up the line, really a conversation about how ADHD weights are reported nationally, because there ought to be consistency. But it does affect our 78-week weight position, because we're counting those figures for one of our organisations, whereas other systems aren't.
Yeah, I've got Moira and then Wendy. Moira.
I mean, just a general point really about process, really, rather than the detail. I mean, there's a huge amount of really rich information in here. And I know it's been discussed, I'm sure, in detail at executive meetings, but it's just how are we as a board assured, and have we got enough, are we allowing sufficient time at board meetings to have salaries on this? We need to have our own salaries so that we're supporting ourselves in terms of where we need to make improvements.
I agree with that. We need to, given that this is not going to subcommittee, we need to give it sufficient time at board level, and we need to think through that. And where we put on the agenda doesn't help with that sometimes. Wendy, I know you want to speak something.
Thank you. Just want to build point that Gavin's point there, really, in terms of the conversations that we're having in as an MHLDA community about parity of esteem, and what would that look and feel like within the ICB if we truly were in that space. And my observation about the IPR is that doesn't feel like we're giving parity of esteem of attention to MHLDA issues when you're making the Sheffield situation to one side. Is actually one of the biggest risks we see it. On the and Leslie on the quality agenda quite often. Children and young people keep an autistic diagnosis anywhere between 29 months wait and 4 years in South Yorkshire, and that cannot be right. So we know that that's something that the Alliance is wanting to step into and try to tackle. But there are some things out there about the BAF quality and the things that the IPR should be focusing on at a really high level to get us really into the weeds about what we're doing to turn the tankers around in some of these spaces. So I just want to particularly make the point about parity of esteem and the shape of the IPR.
I think that's important. When I once did some work for ASDA years ago, long story. And Archie Norman used to say, if you don't measure it, you don't take it seriously. And some mental health things are a really good example of that. It's kind of too far beneath the surface. So something, you know, a well-rounded IPR would have some of that hit you in the face, wouldn't it? Shahida.
Just picking up on Wendy's point, I mean, it's not just about the 29-month and 4-year wait. That has then knock-on impacts on access to appropriate specialist education.
Yeah.
Have access on how, it affects the whole family as well. I think you're absolutely right to raise the point that the way that you have. But I think it also comes back to the wider system perspective as well, that we take it out on health as well. I mean, we're the primary driver for it, but if we don't get that bit right, it has a knock-on effect on a whole range of other systems impacting people's lives, education, and everything else. I think, yeah, you're absolutely right. We do need to.
Yes, I just want to last brief comments. It's just to say that I mean, Kieran, you and your team are doing quite a lot of work around how do we make the IPR more accessible and useful, but also clearer in terms of the actions that are being taken to address variance. So I think that's the first thing. Second, as a consequence of partly as a consequence of the changes at NHS England, but also our running cost allowance programme. The team that Mel's part of currently, the locality team, will be across into the ICB, but also as we're doing our organisational redesign, we're creating a new function within the ICB, the performance and delivery function, that I think will be able to service this agenda in a different way that might address, I think, some of the points that you're making, Moira. So we won't see that until the new financial year, but I think we'll see a change in this space and how we do this part of our business.
Thank you. Thanks, Mel. Thank you. Corporate assurance report.
Thanks, Chair. I'll be very brief and take the report as read, but there are 3 themes I just want to tease out.
Please.
The first is the execution of our corporate affairs and process duties are set out in the report. So such things as compliance with freedom of information and complaints, they're set out and they're available for information. Second item is there are several policies that made their way through our internal governance processes. They've been through some confirm and challenge that been, if appropriate, to an insurance subcommittee or most particularly to the operational executive. And they're presented here for completeness and for adoption. And then the third thing I just wanted to tease out, which hopefully is at the end and the culmination of the conversation today, relates to the board assurance framework and the corporate risk register. But I just wanted to flag the consistency between the conversation today and the risks and the issues that are set out in our board assurance framework and corporate risk register. Just to give a couple of examples in terms of our top 2 board assurance framework risks, we have identified the financial environment and delivery of place transformation work streams, which we've covered through and considered as part of the finance element of the discussion today. In terms of the corporate risk register, there are a significant number of risks, and a number of those are high risks, and they do include the conversation points we've had today around delivery of place transformation work streams, the DRI estates challenges, and challenges around workforce, winter resilience, and the winter plan. And our issues log, which are where risks and are now matters that are issues because they're manifest, they absolutely relate to the conversation today. So, and I won't go through those. So, I'll take any questions or discussion on those matters. But that's the summary of the corporate assurance.
We need to review the cyber data, fire safety, fraud, bribery, and health and safety. People happy to accept those policies? Any other questions, Mark? Well, thank you for that. For information, the place committee meetings. Anything people want to pick up on that? Assurance committee minutes. Any assurance committee chairs, anything you want to add that hasn't been picked up today? Thank you. That's the end of the meeting. Thank you very much. I failed miserably. I apologise. 8 minutes over. We do not have a private meeting of the board, but we do have a remuneration committee meeting, and it only takes a short period of time. Can I suggest that we